Welcome to Snackable Health with Doctors Gibson and Kohli, and we're talking about hepatitis in kids. What's the update? Is it vaccination, COVID? We don't know. Where are we?
So alarming to see so many cases of very scary, fulminant, aggressive hepatitis in kids, some resulting in liver transplantation, some unfortunately resulting in death as well. And this is a real head scratcher for us because we're not entirely sure what's causing it. We have ruled out the hepatitis viruses, which are the most common cause of hepatitis or inflammation of the liver. So we don't think it's related to that. What we're seeing is a pattern where about half of the cases in kids those kids have tested positive for a virus called adenovirus. Now, adenovirus is normally a virus that causes cold infections and very rarely can cause this type of hepatitis except in immunocompromised hosts. So the fact that we're seeing it now in, otherwise healthy children without medical history is concerning. There was some chat on social media about whether this was related to COVID or to COVID-19 vaccination. And the CDC doesn't think that there appears to be any sort of link.
Well, that's good to hear. So, what do you know? I mean, how do we know if your child has hepatitis?
I think parents really need to have their guard up because we're now seeing it in many countries, many different states. And so, kids get GI bugs or stomach bugs all the time. Nausea, vomiting, diarrhea, fatigue, those are the early signs. So that's not necessarily concerning. But when it starts to be more than just a stomach bug, in other words, there's a lot of lethargy, there's very poor feeding, they're not eating at all. If their skin turns color, that's called jaundice. If their stool changes color, it becomes clay colored. If the whites of their eyes start to turn yellow as well, any of those concerning findings, or the illness is lasting for a long time, it's important to have a low threshold to call your pediatrician and discuss this with them.
Thanks, Payal. And thanks to all of you for joining us here at Snackable Health.